Ladies and gentlemen, good morning and greetings from India. But of course, the webinar is being conducted from Ras Al Khaimah in the UAE. Welcome on this lovely morning in India on the 8th of September. This is our third webinar in the RAC DC 23 series. I was fortunate to go over the slides that Dr. Madhurima would be presenting, and I noticed in one of the slides she had mentioned a statement which said, exercise is medicine. The topic, of course, you know, is about exercise and diabetes. And when Dr. Madhurima mentioned that exercise is medicine, it took me back more than a decade to a book that Harvard had written with the same name, Exercise is Medicine. And I was fortunate to be an author, not an author, but an editor of that particular book, Exercise is Medicine. It was a great privilege. Now, if exercise is medicine, as Harvard claims, and as Dr. Madhurima will enunciate, I'm sure, during her presentation, then obviously exercise can be used as medicine for certain ailments. And I have often said that exercise is probably a common medicine for almost all ailments, not only to support medication for the improvement of illness, but also in many ways to prevent illness. However, in this instance, what I am curious to see is how exercise is medicine in diabetes. Why should a diabetic, like most of us listening in on this webinar, why should a diabetic do exercise? What is the medicinal value of that exercise? And in order to enlighten us on this subject, we have invited our colleague, a member of the Arabian Wellness team, to talk about this subject. And the invitation goes on specific qualifications. Dr. Madhurima completed her studies in homeopathy many years back, and then went on to do a postgrad diploma from the Apollo hospitals in preventive and promotive healthcare, and then added to that a fellowship by attending the program that Harvard had conducted in India. Most interestingly, Dr. Madhurima is also a diabetes educator. And I can see from her profile that this comes from her validation or certification from the International Diabetic Federation. And what makes her especially relevant to our subject today is she is a registered, certified, qualified fitness trainer, certified in the UAE. From a work and medical aspect, Dr. Madhurima has several decades of experience in the area of health and wellness. While she was in India for several years, She worked with the Apollo hospitals, a pioneer in the space of health and wellness, and was located in the capital in Delhi. Closer to now, when she moved over to Dubai, she was associated with and worked with the Rat Diabetes Center in Dubai, where she propounded the philosophy of health and wellness to our several grateful clients who were diabetic. And right now, Dr. Madhurima is working with the RAC Hospital and Arabian Wellness, looking after our school scheme. Her objective is to keep the children who are citizens of the future healthy. She's experienced in the area of health and wellness, as you will see, and is constantly lecturing on this subject to thousands of corporate individuals, and more recently to several hundreds of school children. But enough said. I leave you in the good hands of Dr. Madhurima. Doc, ma'am.
Thank you. Thank you very much, Professor, for your very kind introduction. And hello, everybody. Welcome to this webinar today. And today we are going to talk about exercises and diabetes, and we'll discuss as we go further. Let me share my slides over here, and then we can start. All right. Hope it is visible now.
Very clear, Doc M.
Okay, all right. So, as Professor said, today we are going to talk about exercises and why they are so important in, especially if you are having a diabetes, how they can going to help you in your course of life after you are doing these exercises. So, what is the importance of exercises? What kind of exercises we should be doing, and how much? And what are the safety precautions we should be taking while doing this exercise? So all this we'll discuss today. So as we are all aware that diabetes mellitus has become a growing health hazard. Each year, many people are falling prey to this disease. And now it has become an utmost necessity to contain this spread. Why? Because diabetes is a silent killer. Diabetes is a metabolic disorder where there are high levels of sugar in your blood and abnormally high levels of sugar in the blood. And if they are not, they go on secreting persistently, each cell of our body or the systems, they get affected by this high level of sugar. And eventually, if it is uncontrolled, this leads to complications like your silent heart attacks, nerve damage, problems with the eyes, problems with the kidneys, even amputations, etc. So we must take action and do something to prevent it or to maintain it. So there are a few types of diabetes, like type 1, type 2, gestational diabetes, that is diabetes happening during pregnancy, and pre-diabetes. But most prevalent are type 2 and pre-diabetes. So what causes? So cause of diabetes could be because of autoimmune diseases, genetic diseases like in type 1, hormonal like in gestational. But majority of the diabetes is caused due to lifestyle factors or faulty lifestyles. Because as we have seen, majority of diabetes are type 2 and pre-diabetes. almost more than 90% of them are come into this category. And this category, diabetes, is mostly because of our faulty lifestyles, like we are lacking in exercises, eating unhealthy, eating habits are unhealthy, we are having tremendous stress, and there is a lack of sleep. So when this disease is majorly of a lifestyle related one, so we must approach this disease as a different manner. That means we should have a 360-degree approach in managing this disease. So what I mean by 360 degrees is, yes, along with your medical management or along with your medicine, you must also have a lifestyle therapy. A lifestyle therapy means where your nutrition, your exercises, weight management, reduction of stress and sleep, all this also should come into this into your protocol of management of diabetes. Of course, you must have your regular checkup with your physicians. You must take your medicine on time, and monitoring your blood sugar levels in a periodic manner. So here I would like to mention about the stress too, because we all know how your diet and weight, they are directly correlated with your diabetes. But even stress, so whenever we are stressed, there are stress hormones like cortisol and adrenaline, they secrete from the body. And these hormones called the spike cause the spike in your blood sugar levels, because they prepared the body for fight and flight reflex. So if there is a chronic stress, so chronically, if these hormones are getting secreted, that means your blood sugar levels are going high all the time. So it is must that you manage your stress levels also. So this is how your plan for managing diabetes should be there, like having a holistic approach and having a 360-degree approach. So let's talk about more about the exercises. Why exercises are so important in treatment of diabetes. Many studies has been done, and many studies have been done for over many periods of time or years together. And they all point out, or they all prove that exercises are very important in prevention of diabetes, treatment of diabetes, and to reduce the diabetic related complications too. So it is well established. So how this happens? Because when you exercise, as you exercise and go forward, this causes the increase in insulin sensitivity for the cells. As we know that insulin is required to reduce the blood sugar levels. Because when insulin is secreted, it goes to the cell and it opens like we can say a door for a cell to go inside, and this way the blood glucose, a cell can use the blood glucose. So without insulin, cell cannot utilize the glucose present. So if there is faulty secretion of insulin, or insulin is there, but your cells are not able to take it up inside them, so then there is a fault in the metabolism of sugar, and sugar levels tend to get high. So improving your insulin sensitivity means your cells are getting more receptive to the insulin, and this way they are more efficiently can use the glucose for the production of energy. So automatically the sugar levels are in the control. Also, we can see as little as doing 30 minutes of exercise every day. That is a non-diabetic person. If he does 30 minutes of exercises per day, he can reduce his chance of getting diabetes by almost 40%. So this is all well-established studies. So this way, exercises are helping so much in containment of diabetes. The other benefits of our exercises are there are manifold benefits of doing exercises. So like reduction in body fat, we all know that. And of course, this fat is also directly related to diabetes. Fat or obesity or overweight is directly proportional to the getting direct risk factors for diabetes mellitus. So exercises reduces body fat, helps in building of the tone and building more muscle mass, preserves your bone density, improves blood circulation, improves your risk of heart diseases, and this because there is a good circulation, there is a good oxygen. All the cells are getting good oxygen and good blood supply. So this way, there is a less risk of getting the diabetic complications. And one more, the exercises not only has physical benefits, but they also have benefits of mind. How? Because when we do a good session of exercises, after that, endorphins are hormones, they are secreted from your brain. So endorphins are also called as happy hormones, and also they are called as a natural painkillers. So the benefit of exercise is both physical as well as mental. So even when if you are stressed out also, this is one way of managing your stress is to do some exercises. Okay, and as we have seen, if there is more stress, then sugar levels are going to be high. Okay, so this way, the benefits of exercise are manifold. One is in your insulin metabolism. Secondly, your body fat, and reduction of stress, and overall your quality of life. So now, how much exercise we should be doing? So as I said, as little as 30 minutes per day of moderate intensity exercises done for 5 to 6 days a week is very good for your blood sugar levels. But if you are overweight or you are having obesity, then of course you must walk more or do more exercises up to like 30 minutes, 60 minutes per day. Make it a 60 minutes per day of moderate intensity exercises. With this cardio activity or aerobic activity, you must be also doing some muscle training or some weight training activities, at least for 2 to 3 days per week. So this much activity is a must. And with that, you should be also having your NEAT expenditures. So what is NEAT? NEAT is nothing but non-exercise activity thermogenesis. So that means whatever activity you are doing in between, means excluding your sleep time and excluding your workout time, proper structured workouts regime. So besides that, all the activities like your daily work at home, daily chores like washing, cleaning, doing grocery shopping, cooking, anything. If you are in the office, going to the office, sitting, everything, all these small activities are counted as a non-exercise activity thermogenesis. And you must pay attention to your needs too. Don't think that, okay, I have done my 30 minutes of exercise session in the morning, and now the whole day I'm allowed to sit or allowed to just be a couch potato, watch TV. Or if you are at office, you are sitting at one place, sitting at your desk for a longer periods. No, try to avoid that. Simple act of just standing up and just getting a walk to get your water or something. Even these activities are going to help you very much in your managing your blood sugar levels. So remember to be active throughout the day also, with the session of your exercises of cardio and muscle exercises. So when we talk about exercises as a structured exercises program, so in that we must be aware of what kind of exercises are beneficial for us. So there are mainly three types of exercises. Uh, they are called stamina, strength, and flexibility. So we must have all these three components in our exercise session, because physical fitness is not only going for a walk and having cardio exercises, or not only going for a gym and doing some muscular exercises and building up your muscles. No, it involves the all-round performance of your heart, lungs, muscles, joints, and ligaments of the body. So what do we mean by stamina exercises? Stamina or cardio or aerobic exercises are all the same. So these exercises mainly target your heart and lungs. So they improve your efficiency of heart and efficiency of your lung capacity. So like walking, jogging, cycling, swimming, aerobic exercises, or Zumba, all these are common into the category of stamina. These are exercises where your heart rate is more and your respiration is more. So these exercises, as we have seen, we should be doing for at least 5 to 6 days in a week, 30 to 60 minutes. And the intensity also matters. Of course, it will be beneficial even if you walk like a slowly. But if to strengthen your heart and strengthen your lungs, you must walk at a certain speed, or do these exercises at a certain training zone. It is calculated by your age and pulse. So you should be exercising between 60 to 80% of your maximum training heart zone. Maximum training heart zone is calculated by your 220 minus your age, which this gives the maximum heart rate, and you have to calculate a percentage according to that. But we should not be going into these mathematical calculations right now for every day. What you can do is observe your breath. So when you are walking, walk little fast, where you should be feeling little breathlessness. You should not be able to talk very freely with your friend or who is there, but not at first like you are feeling dizzy also. So you have to have a like a moderate speed, and then you start to have some perspiration. So maintain this speed for at least 20 minutes. So this, we can say this is like a moderate level of stamina activity. So have this stamina activity for at least 30 minutes per day. Then comes the strength exercises. Strength exercises are for your muscles. So why we should do the muscle exercises? Why it is needed? I don't mean to do these muscle exercises to build up your muscles or bulk them. No, the idea over here is to have a good quality of muscles and less of a fat in the body, so that the energy, the glucose metabolism is at its optimum level. Because whenever we exercise, we use glucose. So the calories are burned, and sugar levels are also maintained. So having a good quality muscles in your body is very important. So what kind of exercises are they? So they can be done with using your own body weight, like calisthenics exercises, or you can use free weights, or you can have gym machines. So many times people don't have access to the gyms, or they don't like to go to gyms. So for them, they can do this body weight exercises very easily at home. So calisthenics is nothing but these are the exercises where we use our own body weight and the gravity to do the exercises, and this way we strengthen our muscles and improve our endurance and coordination of the movements. So examples of this are the common exercises like squats, push-ups, crunches, pull-ups, etc. So these exercises you should be doing at least 3 times in a week. Let's say but if you're a beginner, always start slowly. Don't go about and do the full sets of 15 into 3. No, start with 6 to 8 repetitions for 2 times. Then gradually each week you can add some more repetitions, and more time you can add in that. As you go further and become a like intermediate level, then uh, you can have the assistance of resistance band, so that you are putting more using more muscle power while doing these exercises. So these are the calisthenics exercises you can do at home, and see that you are using all the major muscle groups of the body. That means your upper body zone, lower body, and core muscles. So basically, so these are the very basic exercises, very easy to do, and it can be done at 10 to 15 minutes. But just to remember here to have a proper warm-up before doing these exercises. Next comes your flexibility exercises. Flexibility exercises are the exercises for joints and ligaments. So these exercises are very good for your joints. They improve your balance, improve your posture, and give support to your body. So why balance is important? Because as we age, we tend to lose our balance and we may fall, and this may lead to injuries and then the further complications. So having a good balance is very much important, and for that we must be doing this flexibility exercises. So these are like stretching exercises, yoga, pilates. These are very good for the flexibility. So there are 2 kinds of flexibility exercises in here, like dynamic mobility. That means we are moving all our joints to its normal range. Suppose you can start with your neck and go down to your toe, like neck rotations or neck thigh stretches, shoulder rotations, elbow, wrist, your hips, your knees, and finally toes. So all take each joint and mobilize it to the natural movement, but at its full range. So these exercises can be done as a warm-up session before your main session of strength training. Then there are other type of exercises are static stretches. So one where we are having a movement, and now second here we are just stretching our joints and ligaments. And these exercises can be used as a cooling down exercises after your session of strength training or muscle training exercises. And this is a must to avoid the DOMS, or after exercises you may feel pain sometimes. So that intensity of pain can be reduced with this stretching and maintaining your muscle tensions. Okay. So these are the basically what I told you, stamina, strength, and flexibility exercises regime we should be doing. In that, let's talk more about our yoga exercises also. So whenever I say somebody to practice yoga, they say, okay, I'm not flexible enough. My body is not flexible. I cannot do yoga. But then I'm like, okay, but this is why you should be doing it, isn't it? So yoga, don't think yoga is only for the proficient people who are doing inversions or shirshasanas, or you have to do some complicated twistings, etc. No, this is a very much a misconception that yoga is only flexibility. No, yoga is much more than that. Yoga actually incorporates your physical, mental, and emotional aspects of life too. So yogasanas, this is a physical part. And then there is a deep breathing, meditation techniques that will take care of your mind. Okay. So, and yoga positions like Surya Namaskar. So these are some set of exercises which are done in a particular order. This is I'm just giving one example, and this is a very good exercises involves your whole body. All the major muscle groups are involved, and if it is done at a faster pace, it improves your cardio activity also. So they are very good for your toning muscles, for your cardio, and for the balancing also. So, and they're very easy to do, and in a less amount, you can less period of time, you can have much more outcome out of these exercises. So this is a physical aspect. So here, yoga is taking care of your muscles, joints, and bones, etc. Then comes your mind. So even while doing these exercises, yoga asks you to breathe. There are a breathing pattern for each movements, breathing in and breathing out for each coming into the poses and coming out of the poses. Breathing is recommended. So this breathing, then there is a shavasana for the meditations, of course, and other meditation techniques are also there. Even for the breathing, there are many like a pranayam, Brastika, Kapalbhati, all these different kinds of breathing techniques are there. So these breathing techniques and meditations, they help to quiet your mind and lessen the effects of stress on you. So when you are stressed and when you do these meditations or breathings, the stress hormones like we saw adrenaline and cortisol, their levels start to fall down, and naturally that means your sugar levels are also coming down, because as we have seen, these hormones, they spike your sugar levels, stress hormones. So less stress means less sugar levels. So yoga helps you in diabetes in both ways, having the physical activity and having a mental peace also. So I will recommend that people should practice some yoga at least, and this can be according to your capacity. Okay. So these are again some yoga postures which are very good. I will say it is very good for whole body actually, but mainly for your spinal flexibility and for your internal organs. They are also getting stimulated in this exercises. Here again, I will say one caution that whenever you want to do any yoga or any other exercise, if you're new and not very aware of these exercises or yoga poses, please take some guidance from the expert. Don't just go about and start doing the exercises. You may get injured too. Okay. So this is what we discussed till now. So this is a fitness pyramid, and this is what our activities should look like. So major part of our activity should come from our everyday chores. So this is our needs. So we must have our need expenditures in doing all these things, like your home stuff. Even if you park your car at little further distance, taking stairs at work, simply not sitting more than 1 hour at your desk. Simply you can just get up, or if you have a call, so you can walk and talk. So this way, this little activity levels are going to help in a great way. Then, as we have seen, 5 to 6 times of your cardio activities and 2 to 3 times of muscle toning or muscle building exercises, and very limit your sedentary time. Of course, this is not a sleep time. This is your day activities. So sleep, of course, you have to have, but during day you should have little bouts of leisure activities, and it should not be a major component. So this is how your fitness pyramid should look like. Yes. So as I was talking about the needs, so these are the activities you can do at your office very easily. One thing is a barrier in doing exercises, first and foremost, is lack of time. So if you are pressed for the time, find just 5 minutes in your workplace itself. And then you can do, as we spoke about the mobility exercises, which can be easily done sitting at your desk itself. So like neck stretches, uh, these are the knee stretches, spinal stretch, hamstring stretch. So all these exercises you can incorporate during your workday at office. Okay, try to find ways to be active during the whole day. Okay, so now you're convinced that you have to do exercises, you are all about to go and do it. But before that, you must know your safety precautions. What all you should, all the more because if you are a diabetic and if you are having, you are on insulin, you should be a bit careful. So always, if you are new, always get some medical clearance. Talk to your doctor that you are going to start a physical fitness regime. So get clearance from that on that. Check your blood sugar levels just before your trainers or before your proper exercise workout, and also check your blood sugar levels after the workout is done. Why? Let's see, as we go on, we'll talk about it. So first, measure your sugar levels for before and after. Always keep some sugary snacks with you. That is like fruit juice, glucose tablets, or hand candy, etc. with you. So if at all you feel dizziness or if you go into hypos, we can have something handy to drink it. Of course, drink water. So before you start your session, at least half an hour before, you must have 2 glasses of water before the start of the workout. And then throughout the workout also, you can just take sip by sip, not too much. So drink proper water, because high sugar levels means there are chances of getting dehydrated. Secondly, during your session, see that your session has proper warm-up and cool-down stretches. As we have seen, because our muscles, when you just go directly and start doing some vigorous activity, our body is not ready for that, and muscles are cold. So it is now this is not a very good idea to start immediately high intensity exercises. So proper workout, proper warm-up and cool down after your session. When you are new, start slowly, gradually increase your exercise levels, gradually increase the intensity and frequency of the exercises. Wear proper shoes. This is again most important for the diabetes patients. Pay attention to any injury and examine your feet very often, because in diabetes there are loss of sensation to the feet. There is maybe diabetic neuropathy is present. So you are not aware if there is any injury to the foot is there, and it goes on increasing because there is a less sensation. So always pay attention to your feet. Then pay attention to the warning signs. So if while exercising, you feel extreme fatigue, pain, dizziness, palpitations, fever, or pain, irregular heartbeat, etc., you must stop your exercises there and take some water and wait for some time. Okay. And yes, if you are especially having insulin, if you are having insulin to treat as a treatment for your diabetes, so then it is a good idea to wear a diabetes identification bracelet, so that in case of any adversities, the other people will know that you are a diabetic person, and they can accordingly give you immediate help, like giving you sugar, etc. Okay. Yes, and learn, always have some expert and take expert opinion, and then only you go about your uh, exercise programs. Okay. Now, let's see about your blood sugar levels, what we should do if they are high or if they are low. So as I said, you must monitor your blood sugar level before your start of your exercises and even after the after completion of your exercise sessions too, because the effect of our exercises are they continue till several hours even after you stop your exercises. So you have to know what kind of sugar levels are there in your blood. Okay, so if your blood glucose is more than 250 milligrams, then avoid the physical activity or avoid or postpone having this exercise session. Secondly, if your blood sugar is below 100, then eat some small snack, maybe a piece of fruit, and then wait for 30 minutes and check again your blood sugar level. And if it is above 100, then you can participate in the exercise. So blood sugar level between 100 and 250 milligrams are quite safe to exercise. In these levels, you can safely exercise. If you are taking insulin, then please talk to your doctor regarding if any adjustment is required in the insulin doses before going to exercises. Because depending if you're doing a very high intensity exercises and your exercise duration is, let's say, more than 30 minutes, then you may require less insulin, but that your doctor only will decide to adjust it according to your activity levels. So have that clearance and then plan your exercises session. Okay, in generally, and never exercise in a fasted state. Always have some snacks at 1 to 2 hours before your exercises, and then you can go about it. Okay. And yes, if there is any complication, like if you are having diabetic retinopathy, then you should avoid the exercises where there is a increase in intracranial pressure, or you can say high intensity exercises, and if there is any jarring or jumping is involved. So those kind of exercises, the patients with eye problems, they should avoid it. Okay, so now you know why I said exercise is medicine. So like professor was keen to know how exercise is medicine. So this is why. So we have seen how exercises are helping to stabilize your blood sugar levels, how they are helping in prevention, how they are helping in prevention of complications also. So having listened to all these safety precautions, you might feel little intimidated or fearful, but no worries. These risks are very less when we compare the benefits of exercises. So benefits of exercise are much more than having this risk, and this risk can be easily corrected. So you just have to be knowledgeable about it. So you should know what is happening, and you should be taking precautions according to that. So now we know that exercise is important therapy for diabetes. And one thing is you have to adopt this regime and do it consistently. It is not like that, okay, I'm doing exercises, okay, now my blood sugar are under control and I will stop the exercises. This is not going to help, because eventually all the goodness of this doing these exercises are going to wean down, or they are going to fade away. So keep your consistency in doing exercises. Okay. Yes. And treat your exercises as medicine. As you take your tablets, you must exercise regularly. And don't wait for any motivation. Just act. Okay, so that is from me for now. So thank you very much for listening to me. Over to you, Professor.
Thank you. Thank you so much, Dr. Madhurima. Thank you so much. So, friends, those of us listening in have understood now that exercise is medicine. And Dr. Madhurima has very kindly prescribed in some detail what we should do. But if I were to simplify this, I would simply say that since Dr. Madhurima has said that exercise is medicine, and she has shown us the benefits to the entire body, whether it is the heart, the lungs, the muscles, the joints, and more specifically, diabetic benefits, improvement in the insulin absorption, and things like that. Keeping all these things in mind, we can look to her for a specific prescription, but the general prescription simply is exercise is medicine. So all my diabetic colleagues, please use this medicine to advantage by simply exercising every day, 30 minutes. Just go for your walk and do a few mobility exercises or yoga or whatever it is, keeping in mind your medical limitations or your insulin readings. And if you need more advice on this, please connect with Dr. Madhurima. But remember the basic statement, that is, exercise is medicine to be done daily. It will benefit you. Just one other thought before I pass on to Dr. Wilku, and that is, you know, Dr. Madhurima has created a revolution of sorts in Russell Khaimer by introducing a 5-minute exercise system to about 3,000 individuals in rack ceramics, a 5-minute exercise program done at work, much to the delight and benefit of the organization and the individuals. Friends, I'm sure there are several questions, and Dr. Wilku is the keeper of all questions. I request our esteemed colleague, Dr. Wilku, to kindly take care of the Q&A session. Dr. Wilku, sir.
So thank you very much. First of all, thank you to Dr. Madhurima for a simple and precise presentation, and session was very informative. Thank you very much for that. There are many questions every time we come across regarding the exercise for diabetes and people, those who are obese. So I'll simply pick up few questions which are there in the chat box. So first question comes as ahead. I am pre-diabetic and obese. Generally, it said morning exercises are good. This is a general notation for everyone who says, okay, going to exercise for a morning time is best. Now, he says he is working in a company. What is the best time for exercise for me? It's a general question because most of the people here in UAE or anywhere I know, those who are working will be having less time to do an exercise in the morning. So, Dr. Madhurima, what is your suggestion? What time they should do?
Yes, if they are having time in the morning, that is the only time if they have, they should go about and do their exercises. Only thing, now he's pre-diabetic, so his blood sugar level must not be too high, or they should not be fluctuating. But here, just as a caution, what I'm saying is those people, for them, the blood sugar levels are very low in the morning. That is early in the morning, maybe around like 4 or 5 a.m. So that time you should be avoiding this exercises. But for him, I don't think there is any contraindications. He can go about your exercises in the morning. Only thing, before that, you should have some like a piece of fruit or like a half banana he can eat and then go for morning walk. Very well, he can do that.
Yeah, I think that's the best suggestion. Lavan is asking, my husband is diabetic and has sciatica. What exercise he should follow? Is it safe to do the exercise?
Yes, for him, it is safe to do exercises, but since he has a sciatica, I will recommend he should go to a physiotherapist because sciatica happening because of what is the reason for that? Is there any spinal involvement? He has to evaluate that and he will suggest the exercises. It is better to take advice from physiotherapist in this case, but he can exercise, no doubt.
So the patient should get evaluated for sciatica and then
Yes.
plan the exercise.
Yes.
That's correct. Okay, Ranjit Kai is asking, you have mentioned about yoga is very good for diabetes. Even I was going through it. It was very interesting. What yoga asanas are good for diabetes?
Like I was explaining in my presentation, so yoga is like a holistic system. It is not only the asanas, it is also has a pranayam and deep breathing. So I won't recommend, okay, doing only this exercise and your sugar levels or your insulin will be better. No, this is a very wrong thing to say like that. But having said that, as I said, Surya Namaskars and some abdominal twisting exercises, forward bendings, and opposite, like a backward bending exercises. These exercises stimulate the internal organs also, and exercise like Surya Namaskar is good for your muscles. So as I explained, muscles take up more glucose. And there is some, if you do them faster, you can have a cardio activity also. So all along I have been saying that we want stamina and some muscle exercises and little bit of intensity, that is moderate intensity. So if you incorporate all these three aspects, then any exercise regime is good. So for him, yes, without thinking, okay, only this exercise I'm going to do and my diabetes is going to cure, you should not have this mindset. Have to try to have incorporate all the three aspects.
Yeah, thanks for. Uh, Orhan is asking, my father is on insulin twice a day. Is it safe for him to do exercise and what exercise he should be doing? You will suggest the best exercise for him. Insulin dependent.
Yes, insulin dependent. They also they can, or rather, I will say they should exercise. So, but if they are not doing any exercises before, just start with your walks, simple brisk walk, and that too, again, like I said, monitor your sugar before and after. So, if there is any spikes, talk to your doctor, or hypo or hypers, talk to your doctor and adjust your insulin dose accordingly. But starting simple walk, brisk walk in the beginning should not cause any problem as such. And then eventually, let's say after a month or so, you can go about and having more intense exercises, having some body weight exercises. Then this way, gradually you can improve your exercise regime and fitness.
Yeah, thanks, sir. There are repetitive questions in other formats. Rudresh K is asking, we know regular exercise is good to manage diabetes and weight. What exercise is the best exercise for diabetes? I think everyone wants a quick fix for the exact exercise to be done to manage the diabetes.
Yeah, everybody wants a pre-packaged one package. Okay.
Yeah.
This is what I have to do and to do it. Okay, so maybe I can package for them. Okay, so what you can do is a 10 minutes of your exercises. This is at home, I'm saying. You can do some cardio exercise like jumping jacks or spot jogging for 10 minutes, and then go for about 10 push-ups of 2 sets, then 10 squats for 2 sets, and then the crunches for 10 repetitions. So this is a small package for you. But having said that, go for
people want packages. Yeah.
Yeah.
True. Okay. There is one last question which I will take. There are few questions coming in my WhatsApp also. Hardev is asking, you mentioned about if your glucose level is above 250, then to postpone the exercise. Is there any problem doing it?
Yes, because if your sugar level is high, sometimes if you do very intense exercises where we are going into the anaerobic state, your blood sugar level might spike. This may also happen, but it is very rarely happens, and no need to worry about it. But this you should keep in your mind. So if your blood levels are already high and you are doing intense exercises, so this will again might go higher. So that is why wait for your sugar levels to come down to in a safer zone, then you can exercise.
Yeah, true. Well, I mean, here in the chat box, questions are, I think that was the last question. I will take one question from my WhatsApp. You spoke about yoga. In the internet, they found Kapalbhati is known to be best exercise for diabetes. Do you suggest Kapalbhati?
Yes, as a exercise for lungs and overall your oxygen in uptakes, Kapalbhati is very good. I won't say the only doing Kapalbhati is going to take care of your diabetes. No, that I'm not going to suggest that. Another thing for Kapalbhati is if you are having high blood pressures, or in case of diabetic retinopathy, if you have some problem with your eyes, you should be avoiding this Kapalbhati. You should not do this.
Think that's so much.
Normal person is good.
Yeah, thank you, Doc, for your perfect answers. I think all the participants, those who have asked, so they will be satisfied with the answers. Thank you very much. Professor, what do you?
Uh, Dr. Madhurima. Dr. Madhurima, I am impressed with your replies. I am especially adhering to 2 or 3 aspects. When one of our members of the audience said, why yoga? You pointed out to my mind very correctly that the twisting movements in yoga particularly would be beneficial for the internal massage of the pancreas, which we know is directly relevant to our insulin situation. So, delighted with that answer. Secondly, when we asked for an exercise package, you gave him the exercise package. Well done, well done. And the last one that caught my attention was when the internet mentioned Kapalbhati as an important exercise for diabetes. You mentioned that while Kapalbhati is good, there are contraindications for hypertension and so on and so forth. And you repeatedly mentioned that exercise is holistic and therefore do not look for individual solutions, do the entire program. I appreciate those answers. It is in keeping with my old age knowledge in these areas. Thank you so much. Dr. M, thank you so much. And Dr. W, thank you so much. Now, before I thank our audience, could I have a look at the audience on screen? Is that possible? My back-end colleague, Saloni, etc., is it possible for me to have a look at a screen that indicates the entire audience?
You can click on participate.
I'm sure that will take its time, but I'd like very much to have that screen. I recall in an earlier session, we did see a screen of the entire audience logged on, and that was very good. Well, friends, which now brings me to my thank yous. I want to thank Dr. Madhurima primarily for introducing the concept that exercise is medicine, and by proving to us that exercise is in fact a good medicine for diabetes. I want to thank my audience for participating in this program, and I hope that the information that we provide you is good and sufficient. It's a learning experience for me also. I learn new things every time I sit in on these webinars. I want to thank Dr. Wilku for thinking up the entire concept of these webinars and for managing it back end by inviting the speakers, by selecting the speakers, by deciding the topics. Thank you so much for that, sir. I would like to thank the team behind the webinars, our IT team, RAC Hospital for their various permissions, the IT team, and my very own Arabian Wellness colleagues. And I see on the screen, friends, an invitation or an exhibition or a statement about our coming webinar, which will happen on the 15th of September. Now, if we've spoken about exercise in this webinar, Dr. Wilku has made an excellent choice of presenting us a speaker in the next webinar who will talk about diet and food. And with that, gentlemen, ladies, members of the audience and speakers, thank you so much and good day.
Thank you. Thank you, sir.